this is like clockwork every morning. I put on my mask. I specifically wear a mask that has like ties like this because I don't know if I have a big face or something, but those other masks, they hurt my ears. So they're both tied on both ends. I just pull them in, and I also put my hair up. So I push this up, little poof, hair clip, and then I throw this tie back behind the poof. And this is how I look like on rotations. Cute? Is it cute? Alright, bunch of stuff. Maybe I'll do a what's in my rotation bag. Good morning, guys. I'm on my way to rotations. It's Tuesday, but it's technically Monday because we had Labor Day weekend. I actually had Labor Day off, so that was note to self: don't record on the dashboard. I'm just going to talk to you guys like this because I'm driving. I'm on solid organ transplant rotation right now, so I'm working with very specialized patients. My hours on this rotation is 8 a.m. to 4:30 p.m. I like to go in at least 30 minutes early, especially on a so-called Monday. It's Tuesday, but it's pretty much our Monday since I haven't seen my patients since Friday. A lot of things can change in a couple of days, as well as there's also new patients that can come in. There's 2 doctors that I work under, so I look at my doctor's list and I see what patients are under their list. There's like all these other organ systems, but I work specifically under kidney. So I check on their vitals, blood pressure, make sure that blood is perfusing through the kidneys, look at their medication, see if there's any medication changes that are related to how they're doing, and trying to add on their home medications. Also, like if I come in and there's a new patient, I automatically med-rec them, which is getting like a complete list of their medications, because the ultimate goal when you have patients inpatient is you want to get them back home and on their own. So you get their medication list, add back the stuff that you think that they should be on, so they can get discharged on their home regimen. But most of the time, if they come in, they're going to get a procedure or get things done where they have to be taken off these medications, or at least like in the liquid form, so they're not taking like oral meds. Big thing in inpatient settings is like if the patient hasn't had a bowel movement, the doctors usually don't like to let them to go home. So then I work at my patients in around just depends on who my preceptor is that day, because I'm having 2 preceptors who are co-precepting. They'll find me and then I'll present my patients and what I found to them before we do noon meeting. So the noon meeting is when all of the transplant people, including coordinators, nurses, home people, home health, a bunch of people are involved in this noon meeting. And then we also give pharmacy updates then, so then that's when that happens. And then also if the doctors are present, because right now these noon meetings are over Zoom, but our transplant team are together. So anyone working on the kidneys, if they're not in the OR, they'll meet in this room together most of the time. And then I'll make recommendations if needed. So that's cool. My last rotation was general medicine, which I really loved too. And halfway I was sent home due to COVID precautions. So I didn't get as far as making recommendations to the medical team, but this rotation, so that's what I've been doing. It's kind of cool. I'm at an academic medical center, so everybody there is like my age, like all the doctors are like my age, so I kind of feel like I'm talking to a friend in a way. And I have like 2 weekly topic discussions. Things I went over is CKD, immunosuppression, rejection, common infections in kidney transplants. Of course, we're wearing masks throughout the whole entire day, so you're just trying to get used to like people's faces with masks on, and you don't really know who you're talking to sometimes. Also, today I do work as well, so my hours right now are 8 to 4:30, and then I work after from 5 to 9. So I'm doing clinical shifts at the hospital. I'm gonna go help the staff pharmacist in the central pharmacy where I work at another hospital. So after I get off work, I gotta rush home, change the scrub, engulf some dinner, and then go do that. It is Tuesday, so Tuesday is our busiest day because it's post-surgery day usually. I'm not sure how that's gonna work because it was Labor Day, so maybe it'll be different, but I always come in knowing that it's gonna be busy.